postures and movement, manual handling, work organization, physical environment, lighting, thermal environment, vibration, and noise. Computer ergonomics, work-related musculoskeletal disorders, upper extremity, low back, work stress. Application methods in evaluating ergonomic risk factors, ergonomic interventions, elements of an ergonomics program. Practicum workshop. Ask AI. Alt. Q&A. Session 1. Essentials of Ergonomics Principles No. 20. Risk factors for work-related musculoskeletal disorders, upper extremities and low back. Objectives. At the end of this presentation, you will be better able to explain the relevance and key elements of ergonomics. Describe the scope of occupational ergonomics. Discuss the burden of poor ergonomic conditions in the global and local settings. Demonstrate knowledge of the regulatory framework in mitigating effects of ergonomic risks in the workplace. Origin of ergonomics. Ask AI. Alt. Ask AI. Alt. Ergonomics used by Wojciech Jastrzębowski for the first time in Poland in 1857. Derived from the Greek words ergon/ergos, work. Nomikos/nomos, law, control and orderly assignment. Work to be performed by all the forces assigned to us by our Maker and to relate to all the purposes of our existence. Ergonomics is the science of work. Science of work in the comprehensive and integral sense. Work consisting of labor, entertainment, reasoning, and dedication. Ergonomics, or human factors, is the scientific discipline concerned with understanding interactions among human and other work elements of a system, and the profession that applies theory, principles, data, and methods to design in order to optimize human well-being and overall system performance. International Ergonomics Association Executive Council, August 2000 https://lea.cc/what-is-ergonomics. Ask AI. Alt. Ergonomics is a human-centered scientific discipline that seeks to fit the job to the worker. Ergonomics helps harmonizing things that interact with people in terms of people's needs, abilities and limitations. The diagram shows the components of ergonomics: tasks such as job content/job context, mental demand, tools/equipment including computer, pens, gurney, physical environment such as lighting, thermal conditions, noise, organization including policies, work duration, shift work, overtime, workstation such as chair, table, platform, and in the center of it all, human-centered designs. Ask AI. Alt. International Ergonomics Association. The diagram shows components of ergonomics, which shows cognitive factors such as perception, memory, reasoning, motor response, physical factors including human anatomy, physiology, anthropometrics, biomechanics, organizational factors such as participation, cooperation, socio-technical systems, environment, along with human-computer interaction, communication, teamwork, which all intersect with each other as HF/E, human factors and environment. Ask AI. Alt. Why the need to address ergonomic problems? Ask AI. Alt. Inappropriate ergonomic conditions are related to imbalance in the work system as it can have effects on performance including low product quality, high rate of errors, material wastage, equipment damage, as well as effects on health such as musculoskeletal, vascular, visual/ocular, hearing, skin, psychological, which can cause outcomes including absenteeism, accidents, increased medical costs, increased compensation claims. 0. Ask AI. Alt. Work-related musculoskeletal disorders, global perspective. The table shows global and regional burden of disease and injury in 2016 arising from occupational exposures, a systematic analysis for the global burden of disease study 2016. The study revealed that ergonomic exposures associated with low back pain, injury risk factors and noise were responsible for the greatest overall burden as measured by disability-adjusted life years. Dallas, GBD 2016 Occupational Risk Factors Collaborators. Global and regional burden of disease and injury in 2016 arising from occupational exposures, a systematic analysis for the global burden of disease study 2016. Occupational Environment. 2020. Ask AI. Alt. The table shows the employer-reported workplace injuries and illnesses, 2021 to 2022, USDOL, BLS, 2023, which include overexertion and bodily reaction, contact with objects and equipment, falls, slips, and trips, exposure to harmful substances or environments, violence and other injuries by persons or animals, and least is transportation incidents. DJTR stand for days of job transfer or restriction cases, while DAFW mean days away from work cases. ASCII. Alt. 502,380 workplace musculoskeletal disorders that resulted in at least 1 day away from work. Annualized incidence rate, 25.3 musculoskeletal disorders per 10,000 FTE workers. Among transportation and material moving occupations, most DART cases were due to overexertion and bodily reaction. Note, DART stands for days away from work, job restriction, or transfer. The graph shows work-related musculoskeletal disorders, prevalence, costs, and demographics in the EU, European Agency for Safety and Health at Work, 2019, percentage of workers reporting different musculoskeletal disorders in the past 12 months, EU 28, 2010 and 2015, MSDS most prevalent work-related health problem, roughly 3 out of 5 workers in the EU 28 report MSD complaints, most common types of MSDS reported, backache and muscular pains in the upper limbs, of all workers in the EU with a work-related health problem, 60% identify MSDS as their most serious issue. Proportion of workers in EU 28 reporting MSD complaints decreased slightly between 2010 and 2015. Source, Pantala based on the 5th, 2010, and 6th, 2015, waves of the European Working Conditions Survey, EWCS. ASCII. Alt. This table shows the top 3 occupational diseases in the ASEAN region. ASEAN Diagnostic Criteria on Occupational Diseases Meeting, 2014. ASCII. Alt. Work-related musculoskeletal disorders, the Philippines situation. Sources of data on occupational illnesses and injuries in the Philippines for the occupational/work-related diseases and injuries include compensated claims, submission from companies, nationwide sampling survey and research and case studies. ASCII. Alt. Nationwide Sampling Survey. Dole Bureau of Labor and Employment Statistics Integrated Survey, BITS. 2003/2004. 2007/2008. 2009/2010. 2011/2012. Philippine Statistics Authority Integrated Survey on Labor and Employment, IL. 2013/2014. 2015/2016. 2017/2018. 2019/2020. Reference period, 2019. Integrated Survey, Integrated Data Set. Employment of specific groups of workers. Occupational shortages and surpluses. Training of workers. Productivity improvement and gain-sharing practices. Occupational safety and health practices. Occupational injuries and diseases. Labor cost of employees. Operational definition. Occupational disease. Abnormal condition or disorder. Caused by exposure over a period of time to risk factors associated with work activity. New case recognized, diagnosed and recorded during the year. Not from occupational injury. Work-related musculoskeletal disorders. Caused or made worse by work such as exposure to forceful exertions, highly repetitive motions, awkward body postures, vibrations, etc. Not due to trauma. Source. Based on a survey of occupational diseases in establishments employing 20 and over, 2021, 2021/2022 IL, PSA work-related musculoskeletal disorders rank second with 38,544 cases or 29%, while work-related COVID-19 infection was the first with 79,620 cases or 60%, this included 5.2% neck-shoulder pain and 19.2% back pain. ASCII. Alt. The table shows the trend of occupational diseases in all industries, establishments employing 20 and over, except agriculture from 2003 to 2021, work-related musculoskeletal disorders persistently ranked first except during the pandemic. ASCII. Alt. Occupational Safety and Health Practices, 2021, 2021/2022 Integrated Survey on Labor and Employment, PSA percentage of surveyed establishments employing 20 or more workers by OSH policy/program implemented, 2021/2022 IL, source, Philippine Statistics Authority, Integrated Survey on Labor and Employment. This table shows the percentage of companies without policies/programs for the following: Program on Ergonomics, Indoor Air Quality Program, Stress Management, Healthy Lifestyle, Industrial Hygiene Program, Promotion of Mental Health, Random Drug Testing Activities, Monitoring/Surveillance of Occupational Diseases, HIV Policy on Non-Discrimination, Hepatitis B Policy on Non-Discrimination, COVID-19 Health and Safety Measures, Tuberculosis Policy on Non-Discrimination, Emergency Response Preparedness, Comprehensive Policy on OSH, Work Accident Prevention Program, Promotion of Drug-Free Workplace Policy and Program on Anti-Sexual Harassment, Fire Prevention and Control Program, and Policy on Smoke-Free Workplace. ASCII. Alt. The graph shows cases of WMSDs as percentage of total occupational diseases based on Labor and Employment Sampling Survey, 2009, 2011, 2013, 2015, 2017, 2019, 2021. All industries including agriculture, establishments employing 20 and over. ASCII. Alt. This graph shows the types of WMSDs based on Labor and Employment Sampling Survey, 2009, 2011, 2013, 2015, 2017, 2019, 2021, and includes back pain, neck-shoulder pain, shoulder tendinitis, carpal tunnel syndrome, other work-related musculoskeletal diseases. Sources of data: Bless Integrated Survey 2009/2010, 2011/2012, Dole Bless, Integrated Survey on Labor and Employment 2013/2014, 2015/2016, 2017/2018, 2019/2020, 2021/2022 PSA. ASCII. Alt. Mitigating the effects of ergonomic risks. Managing cause vs managing effect. Assessment of risks for adverse safety and health outcomes due to poor ergonomic conditions should aim at reducing exposure before injuries or illness occur. Ergonomics programs are installed early in the life cycle of the company, so initiatives are geared towards modification of working conditions and lesser extent on treatment of disorders. Long-term outcome: more efficient and effective programs. Addressing ergonomic risks in the workplace. The diagram shows a cycle including steps such as to identify what is the problem, identify the risk factors, next is evaluate how big is the problem, assess and evaluate the risk factors and exposure outcomes, then select what can be done, analyze the situation and select the appropriate interventions, next is to implement, how do we go about improving the conditions, prototype and implement the most appropriate interventions, and lastly monitor, have we solved the problem? Monitor and evaluate effectiveness of interventions. ASCII. Alt. Strategies to prevent and reduce the burden of occupational and work-related injuries and diseases, RA 11058/198-18, OSHS. Asterisk mandated structure. An OSH committee must be set up to design, implement, and review the OSH program. Asterisk mandated OSH personnel number, competency, responsibilities. Training and skills required for all OSH program planners and implementers. Asterisk mandated OSH programs. Risk assessment and control measures, medical surveillance. Asterisk mandated repertorial submissions. Reporting of exposure data, occupational accidents, injuries, and diseases mandatory. The diagram starts with OSH policy pointing towards OSH program including industrial hygiene program, occupational health program, capacity building on OSH, social accountability programs, environmental protection, immunity relations, safety control and emergency preparedness, which leads to OSH indicators and productivity. ASCII. Alt. Philippine Policy Framework on OSH. The Labor Code of the Philippines and Republic Act No. 11,058, Acts strengthening compliance with occupational safety and health, OSH, standards and providing penalties for violations thereof, are the legal basis for the Occupational Safety and Health Standards Manual. ASCII. Alt. OSH Regulations. Duty Clause. Each employer shall furnish his workers a place of employment free from hazardous conditions that are causing or are likely to cause death, illness, or physical harm to his workers. OSH Programs. Covered workplaces shall develop and implement a suitable OSH programs. Safety and Health Hazard Identification, Risk Assessment, and Control, HIRAC. Medical surveillance for early detection and management of occupational and work-related diseases, and first aid and emergency medical services. Drug-free workplace. Mental health. Healthy lifestyle. HIV and AIDS. Tuberculosis. Hepatitis B. OSH standards. 1030, Training of Personnel in OSH, Dole Do 16. 1040, Health and Safety Committee. 1050, Notification and Keeping of Records of Accidents and/or Occupational Illnesses. 1070, O and Environmental Control. 1080, Personal Protective Equipment and Devices. 1960, Occupational Health Services. Department Circular No. 1 Series of 2008. Policy Guidelines Governing the Occupational Safety and Health of Workers in the Call Center Industry and Technical Guidelines on Safety and Health for Call Centers. ASCII. Alt. Components of the Occupational Safety and Health Program, A. And Environmental Control. 1080, Personal Protective Equipment and Devices. 1960, Occupational Health Services. Department Circular No. 1 Series of 2008. Policy Guidelines Governing the Occupational Safety and Health of Workers in the Call Center Industry and Technical Guidelines on Safety and Health for Call Centers. ASCII. Alt. Components of the Occupational Safety and Health Program, A. Hazard and Risk Prevention and Control Reduction of Exposure and Risk of Disease and Injury, B. Capability building for members of the Safety and Health Committee. Risk management activities through information, training, and work environment safety and health interventions, C. Referral and access to medical and welfare services. Appropriate services as required under Rule 1960 of the OSHS shall be made available, address physical, ergonomic, and psychological aspects of work environment as well as the health and safety needs of the workers. Technical Guidelines on OSH for the Call Center Industry. Checklist-based risk assessment focused on priority OSH concerns including computer use, injuries to the ears, voice care, addressing night work, managing stress at work, risk assessment, physical environment, workstation, job organization, and individual and psychosocial factors. ASCII. Alt. Dole Order No. 119.12 Rules Implementing Republic Act No. 10151. An act allowing the employment of night workers, thereby repealing Articles 130 and 131 of Presidential Decree No. 442, as amended, otherwise known as the Labor Code of the Philippines. Source: https://www.officialgazette.gov.ph/2011/06/2/1/labor-sites-life-and-benefits-of-life-for-women. Section 3. Health Assessment, without charge and to receive advice on how to reduce or avoid health problems associated with their work. Section 4. Mandatory facilities shall be made available for workers performing night work as provided by OSHS Rule 1960, etc. ASCII. Alt. Employees Compensation Commission, Board Resolution No. 13-1136. Musculoskeletal disorders. Refers to traumatic and non-traumatic inflammatory, degenerative, and acquired conditions affecting muscles, tendons, ligaments, joints, peripheral nerves and blood vessels. Disorders of the spine, shoulder, elbow, wrist, and hand, knee, ankle and foot. Exposure to trauma, forceful and repetitive work, lifting, vibration, improper posture in the performance of assigned tasks. Department Order 178-17. Safety and health measures for workers who by the nature of their work have to stand at work. Date posted, August 25, 2017. Purpose: to address the occupational health and safety issues and concerns related to standing for long periods, frequent walking, or wearing high heels, such as strain on the lower limbs, aching muscles, hazardous pressure on hip, knee, and ankle joints, sore feet. Coverage: all workers who have to stand for long periods or are frequently required to walk at work, such as retail and/or service employees, assembly line workers, teachers, security personnel. Occupational safety and health measures: rest periods, work surfaces with adjustable heights to allow workers to alternately sit and stand while working, appropriate flooring or mats such as wood or rubber floorings, readily accessible seats, practical and comfortable footwear should not pinch the feet or toes, well-fitted and non-slipping, with adequate cushion and support the arch of the feet, either flat or with low heels, wide-based or wedge-type heels, not higher than 1 inch. ASCII. Alt. Dole do 184-17. Safety and health measures for workers who, by nature of their work, have to spend long hours sitting. Date posted, October 18, 2017. Purpose: address OSH issues and concerns related to sedentary work such as MSDS, hypertension, diabetes, obesity, etc. Coverage: all establishments with workers who, by nature of their work, have to spend long hours sitting while at work. Computer, administrative, and clerical works. Working in highly mechanized establishments. Working in transportation, toll booths, BPM. All other processes and industries where sedentary work is observed. Formulation of workplace policies and programs, i.e., institution of appropriate control measures to address the risks to safety and health of workers who spend long hours sitting at work. Enforcement and monitoring by Dole ROS. Department Order No. 237, Series of 2022. Revised Implementing Rules and Regulations of Republic Act No. 11165, Telecommuting Act. Signed on September 16, 2022. Employers and employees to jointly adopt and implement telecommuting programs that are voluntary and mutually consented. Telecommuting arrangements shall not be less than the minimum labor standards and shall not diminish the terms of conditions of employment. Telecommuting refers to a work arrangement that allows an employee to work from an alternative workplace, in whole or in part, with the use of telecommunication and/or computer technologies. Labor Advisory No. 08 Series of 2023. Safety and health measures to prevent and control heat stress at the workplace. Date posted, April 5, 2023. Acclimatize your body, gradually expose yourself to heat over 7 to 14 day period, drink plenty of water, wear light-colored and loose clothing, schedule rest breaks, stay in shaded or well-ventilated areas, have a buddy system. ASCII. Alt. Effective ventilation and heat insulation in all areas with workers. Adjustment of rest breaks or work locations to allow recovery from heat exposure. Provision of temperature-appropriate uniforms and PPEs, example hats, goggles with protection against ultraviolet rays, comfortable light material long-sleeve t-shirts. Provision of free and adequate drinking water at the workplace. Enterprise-level interventions. Worker empowerment, self-reporting of conditions for improvement, OSH point person capacitation, utilization of simple, practical tools to evaluate workplace exposure, enterprise-level voluntary action, improvement of workplace conditions towards or beyond compliance. ASCII. Alt. Human Factors and Ergonomics Society of the Philippines. Dedicated to promote the professional practice of human factors and ergonomics in the Philippines. Mission: to encourage education and training in the field of ergonomics and to promote cooperation among organizations with interest in ergonomics and human factors. It was established in 2012 with the following objectives: encourage education and training in the field of ergonomics, promote professional practice of ergonomics, exchange information with other individuals and organizations on ergonomics, cooperate with other organizations and/or institutions, organize an annual ergonomics congress or conference, publish information materials to promote and enhance communication. 7. Establish research and application priorities in the field on the basis of current research and future needs. 8. Support research and application projects either in cooperation with government or other private organizations or on its own initiatives. Act as an information source center in the field of ergonomics. Networks.